Yes. So everyone can read this? Montana?
Yes, sir.
Yes,
Yes.
sir.
Yes, sir.
So Arnica montana is a wonderful drug for AV congestion. And arnica is suited to arteriovenous congestion and inflammation in perhaps to veno-arterial or all typhoid disorders as well. So the arnica sphere of action is very strong. Yes. So arnica,
किसी ने अनम्यूट नहीं किया है ऐसा लग रहा है.
अरे उसको म्यूट तो किया मैंने बट okay. So arnica is a wonderful drug for which has lot of sphere of action in veins, in arteries. So if suppose you are dealing with a case of especially in AV malformation cases, you should choose arnica as a wonderful drug. Also in the cases where there is a lot of palpitation in heart and due to that they cannot sleep at night. So arnica will actually help in this type of conditions. And also in angina attacks, your first drug should be always arnica. Always. Either 0/1 in LM potency, either 6, 30, whatever you have. If any angina comes, your first drug would be arnica only. Second, arsenic album. So I know there are many drugs which I'm going to discuss. You all have learned about these drugs. So let me tell you something interesting which I have been reading, and I'm very happy to share with everyone about arsenic album, the convulsions. Usually what we think of cuprum met and we think of something Artemisia vulgaris, we think of cicuta. So now I would like to discuss about arsenic convulsions. Arsenic convulsions is when they become very much unconscious with convulsions and the restlessness, and then they become drowsy. So I have bought a rubric in which it has been written, they have a lot of heat flushes or burning of whole body. That is what we call epilepsy with aura. Okay, so when the patient comes to know that he is going to suffer from an epileptic attack, they feel whole body is burning. That is a peculiarity of arsenic album. Next, arsenic, we know there are a lot of thirst in arsenic and they have a lot of anxiety. So on arsenic, like if the people are coming with the symptoms of cold, cough, and you find any cause due to cold, your arsenic will be the first choice. And what arsenic desire? Drinking in sips. And which water? Warm and cold both. It's nothing like, they always want warm water. They can have a cold water as well, but it disagrees with them. And warm suits. That is a difference in arsenic album. But ailments after eating cold ice cream or any cold ice, and then they're catching coryza, cold cough, anything, your arsenic will be the first choice. Definitely, they should have a thirst. The next drug which I'm going to talk about, that is ars sulflavum. Ars sulflavum, I don't know how many people know about this, but it is a wonderful drug and the only drug where it has a sciatic nerve pain only in the knee around. That's it. The sciatica is only stretching about only around the knee. It's not going downwards. Usually what happens? Sciatica goes downward to the feet. But in ars sulflavum, the sciatica pain goes only with knee around, only till knee around the knee. And they are amelioration by steam and hot water. So they love to bath in hot water. They love to bath. Next, Astacus flavitis. We all know Astacus is a wonderful drug for urticaria. So urticaria at night and warmth of bed, think of Astacus. But there is another peculiarity of Astacus. It has what? Anyone knows what aggravates? Anyone? If they eat something, their urticaria flares up.
Fish.
Yes, good.
Fish, sir.
Yes. So next drug, I don't know how many know about this drug. This drug actually was taught by Professor Vitholkas. That is aurum iodatum. Aurum iodatum is a wonderful drug, and it should be considered in cases of right-sided sciatica, which has strong pain and numbness when nephilum and colocynth has no results. And the confirmatory symptoms are depression plus sciatica plus restlessness. Then only you can use this drug and get good results in the cases. And the confirmatory symptoms as well, the amelioration is in open air and aggravation is by sitting and lying in the bed. Next, azoospermia. I know many of the people might be dealing with the cases of azoospermia, but let me tell you, there are a lot of drugs, but which drugs have been very good, very, very effective. You see the symptoms. Cobalt nitricum is a wonderful drug, but it has spinal symptoms as well. So correlate with that. Also, X-ray is a wonderful drug when you're tired of giving all the indicated remedies. Think of X-ray. X-ray is a saver, boon saver. And orchitinum is also a wonderful drug. Next, thrombosis of that CRVO, thrombosis of central retinal vein, Bacillus 7, which I'm also going to speak about in Nosot's class. Bacillus 7 has that sphere of action in veins where there is a thrombosis in central retinal vein vein. So this drug is a wonderful drug when you're struggling with a CRVO or BRVO cases. Is it clear?
Yes.
Yes. Next comes belladonna. Belladonna, everyone knows Lycopodium, Nux vomica, all the common drugs which are very used for constipation, even the podophyllum. But belladonna has very, very strong remedy in chronic, in obstinate constipation, where there is like lot of pain in the epigastrium, and when they bend backward, they feel lot of pain more. It's not like diascoria. When they it's like diascoria only. It's when they bend their backwards, they feel better. And what they have, that is involuntary stools and stinging pain in the rectum. So constipation, if you think of lot of remedies in constipation like alumina, you can think of belladonna as well. So always keep in mind belladonna for constipation as well, along with alumina and silicea. Next comes urticaria. Urticaria, if many people coming with, if they touch the object or they hold something, the urticaria comes up. It flares up, right? They come and they can say that I cannot cut a knife also. As soon as I hold, due to pressure, it comes. That's called pressure urticaria. And the wonderful drug is Bovista. Bovista has one peculiarity: aversion to everything during urticaria or in urticaria. That is Bovista. And how they ameliorate? They are warm aggravation. They don't like warm things. But they crave warm food. That is interesting in Bovista. So urticaria coming on excitement with rheumatic and palpitation and diarrhea like Dulcamara. Think of Bovista. So urticaria covers whole body with diarrhea along with metrorrhagia. That's Bovista. So there is a lot of action in metrorrhagia. Bromium. Nowadays, we are struggling with the coughs to treat. When you find failures with spongia and the cough is not at all going away, think of bromium. Bromium is a wonderful drug for dry cough, for the whooping cough, but they have a lot of suffocation inside. And there is a lot of rattling in the mucus. Next, a very wonderful drug and very effective, that is Bufo. Bufo The lymphangitis, you can see the pictures. Everyone can see the pictures here. The lymphangitis is a keynote. I'll repeat, lymphangitis is the only remedy that is like who has indicated that is in Buforana. So in a Hahnemann monthly edition of 1865, we find a case from Lippe. A gentleman 40 years of age had a slight injury in his left hand by the contusion, okay, which left no mark. The lymphatic vessels had swollen up in a large string reaching till the axillary gland, which was swollen. And the swelling had a dark red color and it was very painful. And especially, he could neither sit still or not lie down. Wearing the arm in the sling, walking about gave some part of relief. And the only remedy cured him, that was Buforana. Next remedy, caladium. Caladium is the impotency of the tobacco smokers. Those who have a lot of tobacco and you find he's suffering from oligospermia or azoospermia, only give caladium. And caladium has a typical sweat as well. It attracts flies, the sweet smell. So, and there is a lot of impotency with the depression. And no erection even after caress, no emission and no orgasm during an embrace also. That is caladium, complete impotency. Next comes angioneurotic edema. I know many of the people must be having difficulty in dealing these cases. Let me tell you, you should actually take the modalities well and how they are feeling better in angioneurotic and what is the history. Because generally what remedy comes, that is hipersulfur, urticaria, urines. And when you're tired of giving that also and you're not feeling better, like the patient is complaining he's not feeling better, there is another drug that is called antipyrin. It has not been written. That is antipyrin is also a wonderful drug for angioneurotic edema. So antipyrin, along with that, there is only one remedy, that is calcarea mur. Calcarea mur has a very strong action on angioneurotic edema. Calcarea phos. Calcarea phos has a typical back pain as if, as if there is a separation in sacroiliac articulation. They have so much of pain. And the rheumatic pain is aggravates from draught of air and they have a lot of stiffness. As if they are broken or separated. The same feeling which can be found in asculus hypocastum. But asculus hypocastum has what? Backache with piles, with congestion, with constipation, you can find. But in CP, in calcarea phos, everyone knows the marked desire that will be when you confirm see the constitution. Long legs, long fingers, they're tall, lean, thin, not with
crave smoky
appetite.
chicken.
Correct. And crave smoked chicken or smoked food, crunchy food. That's calcarea phos. And I'll tell you, these people, actually, you can find a lot of cases in ankylosing also. Calcarea phos is a bomb remedy in ankylosing spondylitis as well. The only drug in Materia Medica which you can find concomitant abdomen pain with the ear aching, that is only calcarea phos. This is out of practical experience, I'm telling. I was struggling with a case, and as soon as I gave calcarea phos, it was magical. Patient was complaining he has a lot of ear pain along with abdomen pain. That's it. That was only remedy, calcarea phos. Let me come another remedy, Cardus marinus. Cardus mar is another drug which has ailments from climacteric periods. After or during climacteric period, they have a lot of liver troubles or gastric dysfunction, liver dysfunction. You can definitely find this remedy helpful, which is very similar to lachesis and sulfur. But if you ask the sphere of action more in liver, Cardus marinus always wins in this war. Next, cough. Let me tell you, cough of causticum. There's a rubric like patient is cough deep enough as if he could not cough to start mucus. These are the patients who are coming and telling that I cannot raise my mucus out. So this is the rubric we should use. That's so much deep enough that he could not cough to start mucus. He cannot cough deep enough and he cannot bring the mucus out. That is causticum, miserium, drosera, Calibi, Lechesis, Medorinum. There are a lot of even Justitia. So the woofing cough, which you are struggling with, Justitia, with loss of smell, with a coryza, which is current scenario. In this current scenario, a lot of having many cases are coming up, which as cough is lingering on. So these are the remedies are gem, which is also Justitia, Rumex, Calibi, Stanum Met. You can think of Pertussin, Drosera, Entimtat, Rumex. These all drugs actually saviors. So causticum, all causticum is better by what? Drinking cold water. So if they're coughing, they're drinking cold water or normal water, they are feeling better. That is a typical causticum cough. I think one of the patient also had, one of the colleague actually had it, and I gave causticum at that time.
Yes, sir. Miraculous result.
Yes,
Yes, sir.
thank you. Another, I would like to speak about causticum in the hip pains, especially when the patient complains in gluteus muscles. In gluteus muscles, if they feel like something is holding, like they have grasped by a pair of tongs, they have so much of pain in causticum. In the hip joint, pain as from contusion, and what always mark, if there is a pain along with numbness, tingling, think of causticum. This is very peculiar of causticum. Next, cervicobrachial neuralgia. Today's everyone is facing this kind of symptoms. If you are struggling with a case of cervicobrachial neuralgia, where there is an inflammation of brachial plexus, you find three remedies very, very helpful. That is aconite, ferrum phos, rustox. I'm giving this condition, for this condition only I'm speaking about cervicobrachial neuralgia, not for cervical spondylitis.
Okay.
Now, another drug, hemophilia. I think everyone knows about this drug. It is a wonderful drug for diabetic neuropathy and prostate hypertrophy. But the typical symptom of hemophilia is when the patient is standing, he has to stand 2 feet apart. Then only he can urinate well. That is a typical symptom of hemophilia when you confirm a hemophilia. So they cannot pass a urine. They have to keep their feet wide apart. Then only they can urinate well. So enlargement of prostate, or they suffer from prostatitis. Like what happens? He's suffering from prostate along with has recurrent UTIs. You can use hemophilia, and you can find in the urine REM report a lot of pus cells. So hemophilia is a wonderful drug. Another drug, that is coca. Coca, everyone knows, it's a mountainous remedy. And if the people are visiting a mountain places and after that they are coming or they have symptoms in a high altitude, you can use coca. Or I shared a case during the Materia Medica session as well, that I had a patient. They came from the Himalayas, and they came down to this ground. They had a lot of palpitation in the heart, and as soon as I gave coca, the patient was absolutely well. So that is the sickness. You need to treat the cause, that what had happened and how it started. So this is very important when you take up the case. So coca is a wonderful drug for emphysema also, and loss of voice. In loss of voice also you can use coca. And there is another drug, Populus canadensis, for loss of voice. Populus canadensis. You can read the Materia Medica for this drug for loss of voice. Even the weak vocal cords, hoarseness, they want of breath, short breath, talking aggravates. Coca has a lot of dyspnea as well as insomnia also. Next, cough, aggravation, falling asleep, especially in children, tickling cough without waking them. It was very wonderful rubric which I came across. Tickling cough, but they are not awake due to that cough. And generally what happened? Intim-tart cough, or kali cough, they'll get up and they'll start sitting due to cough. But these drugs, the aconite, chamomilla, and Aurelia resmosa, are the wonderful drugs for cough. They have a lot of cough, aggravates during the sleep, but they are not awake due to cough. So chamomilla is also there. The people who are thinking that chamomilla doesn't have any respiratory action, they're wrong. Chamomilla has a wonderful drug for cough as well. Another drug that is copaiba. Copaiba is a wonderful drug for urticaria in night or early morning. Copaiba is used in urticaria as well, and copaiba has special affinity in urticaria in the genitals. Actually, there are a lot of swelling in the genitals as well in copaiba. So also it has been used in chronic cystitis, and due to chronic cystitis, there is what? When you see the ultrasound of that patient, you will see the report. It has been clearly written that their bladder wall has thickened. Another drug which is along with copaiba used is Parera breva and Uva ursi. These three drugs are wonderful effects whose bladder wall has thickened due to recurrent UTI or recurrent cystitis. And in copaiba, there is a lot of hematuria, lot of blood coming in urine. Another drug that is coculus. Coculus is a wonderful drug for paraplegia as well. These are the people who are, they are known as coculus people are the best caretakers in the world. They can have sleepless nights caring for someone. All night they're caring and not able to sleep. And due to this caring, they have a feeling of so much of care and love, affection to serve others. They face difficulties later on, like they have a lot of sleeplessness, and due to that, all complaints aggravated. Headache due to sleeplessness, coculus. Vomiting due to sleeplessness, that is coculus. Even the joint pains, even in the joint pains, coculus is a wonderful drug. So spasm of electric shock, convulsions after loss of sleep. There is a loss of sleep, and then again they had a lot of convulsions. Think of coculus. Kent has used this in coculus in a case of paralysis of both limbs after diphtheria. So coculus is a wonderful drug for loss of sleep, any complaints arising from loss of sleep. Next drug, cirrhosis of liver. There are a lot of drugs in cirrhosis of liver: quassia amara, cardus, lycopodium. All the polycrest also have, medorinum also has a lot of action. But I would like to describe another drug, that is croton tick. Croton tick is the most reliable remedy in ascites due to cirrhosis of liver. Am I clear? Yes. There is ascites from the cirrhosis of liver. Cuprum met. Cuprum met is a particular feature to be remembered about this cramps that is begins in fingers and toes. Then it spreads from the rest of the body. I know many of the patients come and they complain about cramps which begins in the fingers and toes and they spreads over the rest of the body. That is cuprum met. And recently I treated a case of abdominal epilepsy by cuprum met, because everything she felt in abdomen, and there was a contraction and spasmodic contraction in convulsion in abdomen, and I gave cuprum met and she went absolutely well after cuprum met. So there is a lot of spasm. Next, curare. Curare is also known for a lot of, in neurological sphere. It has a lot of action in neurological sphere and sciatica as well. But it has a typical pain which begins in spine, and there is lot of stiffness. Along with that, their reflexes, they lose their reflexes. If you examine their legs, you will find there is no good sensory or motor symptoms, not well. Actually, if you examine their legs also, you won't find good reflexes in their legs. And also curare is a wonderful drug used in diabetic neuropathy. And there is a lot of trembling in the limbs. So it's also used in Parkinson as well. Let me tell you, curare is also a drug for Parkinson as well. So diabetic neuropathy, I would like to describe few
Okay.
remedies which has been very, very helpful in diabetic neuropathies. That is argentum nitricum, curare, graphitis, lac defloratum, carbonium sulf, and arsenic album. So peripheral neuritis in carbonium sulf, it has been written there are inflammation of the peripheral neuritis. What happens in carbonium sulf is there are diminished sensibility of arms, hands, and feet, and there is the patient has a history of alcohol. So alcohol neuritis also, carbonium sulf helps in these kind of cases. Next, argentum nitricum, numbness in the fingertips. There are a lot of numbness in the fingertips, in the ring and the little finger. And there are a lot of what? Rigidity, twisting in the calves. So there are a lot of numbness. So numbness, if you talk about, you find lot of numbness in diabetic neuropathy. That's why argentum nitricum is also one of the drug, can be used in diabetic neuropathy, but it should have the symptoms like what they feel as if wood, or legs feel they as if made up of wood or padded. They feel like padded legs. So it's not a feeling like same like what Thuja thinks.
Yeah.
They feel like more of their legs are made up of wood or padded. Next drugs, curare. Curare has a complete paralysis of right deltoid, pain and numbness in the left side of chest and left arm. So all heaviness in the arm. So a lot of heaviness you find in curare, and paralysis of extremities, burning with heat and chills. So there are a lot of heat and there are chills, and along with what? Numbness and tinglings. So curare is a wonderful drug for diabetic neuropathy as well, along with other conditions in which, see, there is written what William Boric has clearly written, cannot lift the fingers. They have so much of heaviness, and their weakness of the hands and the fingers of the pianists. So all the piano players. And what happens when they walk? Their legs tremble. They cannot walk. Graphitis, there is numbness and stiffness of thighs and the toes, along with restlessness. Also, there is lot of stiffness and want of flexibility in the knee, which does not permit sitting squat. Remember, people coming and they say they cannot sit in Indian toilet and they want a Western ones. Graphitis is a drug. Next, lac defloratum. So what are the symptoms you can find in lac defloratum? There is numbness and loss of sensation over the outer and the interior surface of the thighs. And along with that, they have weak ankles. Arsenic album, there are a lot of tinglings, burnings, fingers cannot be extended, twitching. These all the symptoms you can find in arsenic. Also, paralysis of lower limbs with atrophy. So there will be lot of burning pains along with the neuritis. They'll keep on complaining. There's a lot of burning in the soul. There's a lot of burning in feelings. Even like I differentiated, they have a wooden feeling in soles. So what and how does argentum nitricum feels? They have a wooden feeling in the legs, but in the arsenic you will find the wooden feeling in the soles. Next, diabetes albuminuria. Also in CKD cases, diabetic nephropathy, calcarea carb. It is a very wonderful drug in albuminuria, diabetic albuminuria. You can find there also in Eupatorium perforatum. Albuminuria, diabetes with highly irritable bowel and enlarged prostate are specifically for this remedy. It has been indicated in albuminuria and diabetes. Leading indication is irritation of the bladder and excellent in renal swelling. Picric acid. The urine has abnormally high specific gravity. So when you do the urine REME in these kind of people, you will find their specific gravity is very high. And then you can find if picric acid to be very useful in these kind of cases where their urine specific gravity is extremely high along with diabetes. Diabetic gangrene, the number one drug that comes is sickle core. I know everyone knows that. Another drugs are Crotalus horridus, Bothrops, creosote, arsenic. These are the drugs which has been very wonderful used in diabetic gangrene.
The gunpowder.
Gunpowder 2. Next, eel serum. Eel serum is another drug which has been lesser known, or nowadays everyone has come across this remedy very well. And this remedy is specifically for hypertensive nephritis with edema or without edema in the limbs. You can use this remedy, especially it comes in eel serum in 7x, or you can use in LM potency, where you find hypertensive nephritis cases and you use Urobi 1 and you see the results. It is marvelous. We have so many case records on them. Emissions, premature ejaculation. There is a special rubric for this. Many people come and complain that before the erection is complete, the semen comes out. The only 4 drugs are indicated, that is caladium, graphitis, and phosphoric acid along with sulfur. I would like to tell, graphitis and diabetes impotency is very, very strong. If you read graphitis male, you'll find good symptoms of male impotency, which is correlation with diabetic people who lose the interest in sexual area. Another drug, Eugenia jumbosa, acne rosea and acne simplex. It is general aggravation from sun. Everything appears beautiful and large, and there is a lot of mood swings. Excitement soon changes to depression. Also used for comedones, as per Boric. So apart from Kali bromatum, if you're failing and you're still not getting good results, you can think of Eugenia jumbosa. Kali bromatum has a lot of more cyst-like appearance. Another drug, that is ferrum picricum. Ferrum picricum is a wonderful drug for prostate hypertrophy with frequent urination at night and with full feeling of pressure in rectum. Now, patient will come and complain that I have problem in urination. Along with that, I have lot of feeling or urge to do stool during urination. The only drug which can save you, that is ferrum picricum when you give.
So will you pardon?
When the patient will come to you and he'll complain that whenever I'm going to do urine, I have a pressure or urge to do stool as well. So they'll come and they'll see that whenever I'm going to do urine at night, I have a feeling that I should go to do stool as well. The same feeling is due to created by hypertrophy of the prostate, which creates a feeling in the pressure in the rectum. And the only drug which can help, that is ferrum picricum. Now, in my practice, I have never used the drug. For the first time I used this drug, that was for warts in the face. And I'd like to show how it gave the result. Can you see?
Wonderful.
Yes,
I use ferrum picricum.
marvelous.
Yes. So ferrum picricum is for face warts.
So due to this symptom, you come to the remedy?
Yes. Another drug, that is Fabiana. Fabiana is very, very less known. It is used for gallbladder calculi and cholelithiasis. Let me tell you, people struggling with cholelithiasis, there is a drug called Feltauri colestrinum. You can use in 30 potency as well. For acute pain of cholelithiasis, you can use belladonna when the patient is sensitive to touch. And when acute pain, the patient is very, very sensitive and hypersensitive to touch of clothes or oversensitive to touch, you can also give hypersulfur. Also, another drug you can think of in cholelithiasis, that is diascoria. Diascoria is a wonderful drug in cholelithiasis as well. So you have to correlate with symptoms. It's nothing like specific. I'm just
Yeah.
mentioning the word cholelithiasis. It has been mentioned in Materia Medica in the under the drugs. So I'm speaking about the drugs which are highly indicated, but all have a different area. Like Feltaury, if you use in cholelithiasis cases, there are a lot of congestion and a lot of laziness in Feltaury. Lot of lazy people, Feltaury. Then you can think of Feltaury in cholelithiasis. So Fabiana is used in uric acid, prostatitis, vesical tenesmus, burning after micturition, excoriating urine, and calculi. Now we'll speak about grief. For grief, ignitia and phosphoric acid are the major condition. Both may have desire for fruits, but definitely ignitia don't like fruit at all. But the difference is that phosphorus loves what? Juicy fruits. And another differentiating point with ignitia is they have strong emotions which unexpressed. We called as undemonstrated grief, which cannot be expressed. That is ignitia. And in phosphoric acid, the emotions are rather paralyzed, which leads to indifference. They're not interested in showing this in phosphoric acid. Another drug, aurum and ignitia. Aurum grief is so deep that it destroys the ego. Whereas in ignitia, the grief comes when the possibility of contact or emotional rapport is cut off. Can be very, very depressed, but not to the points of desiring to commit suicide like aurum. Ignitia, in simple words, they will be engulfing themselves in themselves. They are dwelling themselves in grief and they're not able to express. But aurum may commit suicide due to sadness or grief. Another, ignitia and pulsatilla. When overwhelmed by emotions, they break down in crying. The crying of the two different drugs will be ignitia is weeping is uncontrollable. Uncontrollable. And how they keep racking the body. And where pulse, very sweet. Very sweetly they'll cry, and as soon as you will give a hug or you'll just console them, they'll stop crying and they feel better. That's a typical. This is a confirmatory how to see how ignitia weeps and how pulse weeps. Phosphoric acid people experience a grief so they're weak emotionally. There are a lot of weakness inside. They're like exhausted due to grief. A lot of exhaustion when it speak of acids group. So definitely phosphoric acid is exhausted. And what happens? They have coldness. They have a cold feeling inside. They feel that they can get no help. Same as aurum. But we don't find suicidal tendency in phosphoric acid. They are very, very weak. Next, if you are speaking about phosphoric acid is a wonderful drug for homesickness along with what? Capsicum. So I have bought this homesickness thing. Homesickness, fever during phosphoric acid. Homesickness, heat aggravation, Terminalia arjuna. A wonderful drug for heart. Homesickness with a heat in the throat, capsicum. Now interesting, homesickness, nostalgia house, even when in our own, epitorium perf. So cases with a dengue or cases with any, struggling with a fever and they are in a delirium state and they are telling that please take me home. Please take me home. Because of that experience only, I came to know about this drug. Epitorium perf has this feeling. They'll keep on complaining that I need to go my home. Homesickness, humor, silently ill, humor with nitric acid. Homesickness with indolence, they don't want to do anything. Capsicum and sacrum album. Next, heel pain. I know many of the people are coming with a heel pain. Let me tell you, heel pain, if the person has left-sided tendo-Achilles pain in left heel, think of Calcarea causticum. And the person has right heel pain and they're walking and they're feeling better, think of Arenia diadema. This drug is Wonder Arena diadema is extremely chilly remedy. And the patient comes and they say, if they walk on the carpet, they feel better, and they walk on bare surface, there is a lot of pain. Give Phytolacca. And another people who have lot of spurs in the heels, Hecla Lava 6 works very good in low potencies, not 3x. Another, heat flushes in the body when they put the feet down. Fluoric acid. Chilly patient, history of malaria and motion amelioration, right-sided heel pain, os calci pain, then parts go to sleep. That is Arenia diadema. Another drug, as soon as they step down, the pain shoots from feet to head in hypericum. Another drug, I don't know, many of you might be knowing this, concholinum is a wonderful drug for osteitis. Also in the heel pain, it has a very good action. Another, valeriana. Valeriana, also used in sciatica, it's the same as Rustox. It's absolutely same in Rustox. When you're struggling with a case of Rustox like sciatica or a back pain, not responding, think of valeriana. But valeriana has a typical symptom. If they stretch their leg, there is strongly aggravation. That is a sciatica of valeriana or lumbar pain. And valeriana, pain in heels when sitting, like Rustox. And they are better by walking. Next, indigo. Indigo is another drug used in stricture of esophagus and also in sciatica as well. Stricture of urethras, stricture of esophagus, and they have marked action on the nervous system and the treatment of epilepsy. Indigo has a special reputation in sciatica because this is the only drug where sciatica nerve, when the patient complains that when they sit and they rise, they feel better. And opposite of it, aggravation?
Rustox.
Correct, Rustox. And sciatica pain goes from middle of the thighs to the knee, not from the back. That is indigo. When you find sciatic pain, from the patient comes and shows you with the finger, point of finger, that is grow from here till here. That is indigo. So another drug, iodum. Iodum, as Dr. Tyler has given, if given in iodum CM in 4 successive nights in the full moon, it helps in hyperthyroidism or hypothyroidism. Definitely, it does has a sphere of action, but you need to correlate with totality of it. If prescribed in CM potency. Next, leukoplakia. Leukoplakia, Kali Moor. I know many people might be having difficulty in treating leukoplakia, but Kali Moor is another drug which has been used in this, and Kent has actually given in a rubric discoloration, white spots in the mouth, salicylic acid, mercosol, sulfur, phosphorus, carcinosin. Another rubric you can find, that is blotches under the tongue like a vegetable growth. You can see this like a vegetable growth. Only one drug, that is ambra gracia. And what is ambra gracia? Ailments from embarrassment. They'll hesitate to show you also. Then you can figure out why he is not showing. Lithium carb. Lithium carb I have used in my practice where there is high uric acid plus RA. It's a wonderful drug, lithium carb, in chronic rheumatism, small joints, along with if the patient has a history of rheumatic heart disease. Lithium carb. Lithium carb, they feel like, confusion while standing. They feel like hopeless. All these are mind rubrics of lithium carb. They have a tearful mood, lonesome condition, over is lonesome. They feel a lot of helplessness in the feeling. Alone in the world, unfit for the world. Due to what? Why this feeling comes? Due to their suffering. They have so much of deep suffering. Another, pancreatic calculi. According to Dunham, in lycopodium causes a chronic duodenitis. Pressure on the hypochondrium produces tender pain in epigastrium and vice versa. And along with that, if pancreatic duct is involved, we have well attested dyspeptic symptoms of lycopodium and jaundice, and it is also remembered in pancreatic calculi, that is lycopodium. Now I would like to share this drug. I don't know how many people are aware of this drug, that is Rufa operculata. Is a wonderful drug for chronic sinusitis, chronic atrophic rhinitis, hypertrophy of the nasal mucous membrane, chronic atrophic rhinitis, nasal polyps. This is the only drug which can save you. And you are tired of giving Hepa's helper, hydrastis, even hydrastis. Hydrastis is a very last resort drug used in chronic sinusitis. After Kalibai, when you're failing all of drugs, just simply give Lufer operculata 6 and you see the effect. It acts wonder. Also, it has action in rhinitis as well as pharyngitis. Hay fever drug, lycopersicum, also used in exothalamic goiter as well, lycopersicum. Also used as hay fever. It has lot of symptoms similar to what? Allium cepa. But there is a difference in allium cepa. Allium cepa and lycopersicum is very close. But lycopersicum is aggravated outdoor. There is aggravation. Allium cepa loves to be in outdoor. They have a lot of sneezing, continuous, like Sabardilla. You're struggling with Sabardillas also. Sabardilla, allium cepa. You think of lycopersicum in hay fever. Next, lumbar backache. Rustox, Bryannia, Nuxvomica, Cilicia, Hypericum. These are the wonderful drug can be used. Bryannia, spondylitis with the increasing on movement. Rustox, motion ML, Nuxvomica, due to lifting if they have spondylitis. Cilicia, when there are bony changes. Hypericum, where the nerve is involved. Another, when there are osteophytes involved, Bambusa or Polygonum multiflorum is a drug. Polygonum multiflorum is a wonderful drug for spondylitis with a lot of osteophytes in the spine. Magnum aceticum, it is the pruritus of diabetes. There are a lot of itching. Also indicated in psoriasis and pityriasis. Magnum cause anemia and destruction of the red corpuscles. It has a very strong affinity in skin, Magnum, even cellulitis. There are chronic deep eczema, psoriasis, itching aggravates, itching MLs the scratching, and there are deep cracks in the bends of elbow. And the marked keynote of Magnum aceticum, that is chronic eczema with amenorrhea. The skin disease plus amenorrhea, use Magnum. Mancinella, hair fall after acute illness, fungoid growths. It's a basically insanity remedy, but it has a very strong action in what you know, bullous pemphigoid, where there is big, very bulle. I think students who have learned, I have showed them, right?
Yes, sir.
Yes, yes.
Let's give Mancinella. Medusa. Medusa is same as sepia. Medusa's sphere of action is mainly on urticaria and on the female organs, especially due to where there is no lactation. They are typical sepia, love of music and dance, but their urticaria have a lot of numbness and burning. And these people, they are very silent. They don't want to talk. And these are the patients who never finish their history in one go. And they do not want to answer your questions. They always think of something else to add to their history when they speak about their history. I know many people have come across these people who they keep on telling they have not finished their giving complaints. Think of Medusa. Lack of milk production in breast. It enhanced milk secretion in cases of suppressed lactation. Also suppressed urine for days. Again, Merck Dulcis. Merck Dulcis is a wonderful drug. Patients who are suffering from gonorrhea, a stricture after gonorrhea. Mitral valve regurgitation, where there is a mitral valve collapse with regurgitation, a patient complaining lot of fear or lot of suffering, there are a lot of suffering inside they feel lot of pain. Only two remedies are there, that is laurocerasis and pulsatilla. I know everyone knows this. Discuss desire complaints with everyone. She loves to discuss complaints with everyone around. That is urgent nitricum, phosphorus, and populus canadensis. 3 drugs are only there who have that feeling to desire. They have desire to discuss their complaints with everyone. Menthra piperita is a current drug which is used for dry cough. It is to dry cough, however, cause what arnica is to injuries. According to inflammatory complaints, it relieves even the cough of conjunctives. A single globule is enough. So read Mentha piperita, which has been used where the cough, it was a dry cough excited by entering the larynx or by reading aloud or by exposure of cold or any shocks, due to any shock, his cough started. That is only and only remedy, that is Menthra piperita. Natrum ars, bronchitis of children, remedy for nasal catra, also used in hay fever. Let me tell you, Natrum ars is also a wonderful drug for hay fever. And as written in Boric, facilitates the termination of cold and conserve strength and appetite. So children who are not gaining good appetite and strength after cold, suffering from coryza. Nux vomica. Nux vomica is another drug which has only a remedy which sciatica extending to the hollow of the knee. To the hollow of the knee. Sciatica extending to the hollow of the knee, lifting patient or standing aggravation. You'll find only one remedy, that is Nux vomica. Paralysis from overexertion or getting soaked, like Rustox. Another, esophagitis. So actually I have less time, so let us conclude fast. Esophagitis, belladonna, veratrum viridae, Rustox, arsenic are wonderful drugs for esophagitis. People who are complaining of lot of burning and here due to reflux esophagitis, you think these are the remedies highly indicated. But belladonna has a sense of constriction and they're painful swallow and breathing. Rustox and arsenic, both are very much restless. Palladium is a wonderful drug on the ovaries, or the right-sided ovarian pain, ovarian neuralgia extending to the thighs. Also, there is lot of swelling in the right ovaries and they have lot of pain and extreme pain, which has not been responding to epismale. Think of palladium. Another, petroselinum. Petroselinum is a wonderful drug for urethral stricture as well. Sudden urging to urinate caused by tingling in urethra. So there is a lot of tingling in the urethra, then it has the urge. That is petroselinum. Screams, jumps up and down with pain, unable to pass urine. That is petroselinum. Phytolacca. Phytolacca is a drug which comes between Brinia and Rustox. Electric shooting pains. This is sciatica, runs from hip downward to mostly outward of thighs, worse at night, syphilitic pains. Phytolacca is a drug. Phosphorus cough. I'll tell you something interesting about phosphorus cough. Seems to avoid as long as possible children with bronchial catra. Phosphorus is the only drug. And phosphorus has, like nowadays, current situation, you'll find the child who has feeling, he's not coughing at night. He's coughing on the day. Lot of cough and desire cold water. Think of phosphorus. Phosphorus is another drug for liver dysfunction with lot of jaundice, enlargement, fatty liver, hepatitis, alcoholic cirrhosis of liver, disorder livers in men, spleen enlarged, hepatosplenomegaly. You can find this drug acts wonderful in cases like this. Also, atrophy of liver with ascites and varicose vein. You can feel you can see the vein all over the abdomen coming up. These kind of cases you can think of phosphorus. But it should be lean thin. The constitution should match with the phosphorus. Another drug, phyostigma, increasing myopia. You're struggling with the cases where their power is day by day increasing. Think of phyostigma. Prostate cancer. Sabal cerulata is the number one drug for that. And we all know prostate complaints where there is a dribbling by drops in old people. Sabal is the only drug mentioned in the repertory. But Sabal is a wonderful drug, and it should be first choice of drug for what? Prostate hypertrophy. But in prostate cancer as well, Sabal is indicated along with these remedies like Crotalus with hematuria, Cilicia while staining at stool, Naxomica discharge during stool, Staphylococcus prostatic discharge after sexual access, Selenium discharge during stool. These are the drugs highly indicated, even nitric acid. And conium as well. Perspiration, foot, Cilicia, nitric acid, amon mur are highly marked, these remedies, when they have perspiration only on the soles. I'm not talking about hands and feet. Only on soles. Amon mur as well. And amon mur is another drug used for sciatica. Actually, it is a wonderful drug used for sciatica, left-sided sciatica, amon mur. It has a lot of pain, actually in the lot of pain in the thighs, which restrict walking. Rustox has a lot of pain in gluteus as well, in the hip, drawing pain in the hip and knee joints, spasmodic contraction of single muscular groups and muscular fasces, cramps at night while lying in the bed. So they have a lot of restlessness along with pain, jerking. Pain down back of thighs aggravates. So sciatica people suffering from pain that makes him scream, and they walk and they feel better. That is Rustox. Radium bromatum, another drug found effective in rheumatic complaints associated with skin affections. So have RA, rheumatoid arthritis, lot of skin. You can think of RA, radium bromatum. They have a lot of gouty, uric acid must be high, and they have a lot of aching pains, which is syphilitic. That is lot of pain in night. Sciatica, another drug you can think of in sciatica, that is obstinate pain, aggravation in rest, and when they begin to walk, they have a lot of pain. That is only drug, that is gelsemium. Aggravation in rest, and when they begin to walk, at that time only they have pain. That is gelsemium. Another drug, I think everyone is familiar with this. The favorite drug on sciatica of everyone, that is colocin. Colocin have, the patient is screaming, shouting, howling, and the pain is from hip to knee, and they have stitching pains, tearing, and when they, as soon as they walk or they lift their legs, they have a lot of pain. But as soon as they draw up their limbs upwards, the pain disappears. That is a confirmatory symptom for colocin. Drawing up limbs ameliorates, or bending double ameliorates. Another drug, spongia. Now you're dealing with cough, and as soon as they eat a lot of sweet food, the cough aggravates. Think of spongia. And how the sound? Like?
Saw like.
Correct. Strophanthus. Can you see this corpulent person? Everyone?
Yes,
This
sir.
Strophanthus. This is Strophanthus. Strophanthus is used in anemia, diabetes, heart affection, dropsy, anemia with palpitations. This is a wonderful drug for even the people of, who are abuse of alcohol and they have insomnia. Even dyspnea due to edema of lungs and heart. You can think of dyspnea due to edema of the lungs from heart diseases. You can think of Strophanthus. Strophanthus has a very good drug for heart and kidney and lungs. Another drug, sulfur. We all know sulfur is a very wonderful drug for obstructive jaundice or alcoholic cirrhosis cases where there is a congestion, where in the portal circulation. So sulfur covers many of the symptoms of cholelithiasis, cholecystitis, and cholangitis. There may be dull, sharp pain in the region of the gallbladder, person with a sallow complexion, and they have rumbling in the abdomen, lot of rumbling. Tabacum, losing of vision without any cause. That is loss of blindness, causeless. There is no cause. Tabacum. Another, blindness from alcohol. Terebinth. Blindness from alcohol, terebinth. And there is what? Terebinth is lot of hematuria, UTI, lot of pus cells in urine with extreme burning. Terebinth. Tabacum is also indicated in central scotoma, strabismus. There is a loss of sight on looking steadily at any white object and sudden loss of vision without any lesion, and they have atrophy of the optic nerve. So tabacum, I'll tell you another symptom of tabacum, extreme cases of violent vomiting, which is not at all stopping, along with vertigos. And where there is a coldness in the body, you just give tabacum and see it's vomiting immediately gets stopped. Clear? It is also used in angina with CAD cases. Next, valeriana. Valeriana has a strong affinity, like I discussed, in tendo Achilles, and indicated also for right calcaneus spur. Constant pain in heels when sitting heels are painful, especially the right heel. Restlessness in the state of nervous irritation, like Rustox. They keep on moving here and there, Another, vertigo, sinking as if down through the or with the bed. They feel like vertigo. They are just sinking in the bed. Calcarea fos, also used in cervical spondylosis, lachesis, lycopodium, Rustox. These are the remedy when they have this kind of vertigo. Another, Kali carb is a wonderful drug in the sciatica cases where they cannot rise from the bed. They turn over on the healthy side before they can rise from the bed. That means they turn over to the non-affected side, then only they can rise from the bed, not on the affected area. If suppose the patient has a pain on left sided, he will turn right side, then he will get up from the bed. Am I clear? Same with this thuja. Thuja is another drug where there is lot of injuries in the spine and they cannot walk. As slightest motion of walking, there's a lot of pain in lumbar region. Thuja is the only drug. Next, vinca minor. Vinca minor is used in scalp psoriasis. I know many of the people might be using oleander also, but another drug is vinca minor. There is corrosive itching in the scalp, plica polonica. And vinca minor is a drug for hemorrhagic tendency of the climacteric women who have lot of menorrhagia, continuous flow, not at all stopping. That is vinca minor. Viscum album, sciatica, chronic sciatica case with extremely malignant, I'm not talking about normal hypertension, malignant hypertension. Think of viscum album. Or joint pains plus uric acid plus sciatica plus hypertension. Think of viscum. It's all combo. It's a very deep action on these kind of cases where you find hypertensive albuminuria, even in CKD with hypertensive CKD albuminuria. You can use this if indicated. Also in asthma, they have suffocation when they lie on the left sided. Asthma connected with gout or rheumatism. Now, very interesting part. Viscum album, like asthma plus gout is equal to viscum album. So asthma connected with gout or rheumatism, you can use viscum album. And viscum album is also for sacralization of S1. If you find viscum album, it is a very important drug for sacralization of S1, and due to that, they have a lot of lumbar pain. It's a congenital, but viscum album is used in that person who have they have sacralized spine. So you can use this if they are suffering from any chronic back pain later on, because it's a congenital. So maybe at a later on they get the pain or anything, you can think of viscum album. Another, I would like to discuss few important rubrics, that is painful recurrent wounds Glonine, kali iode, nitric acid, Nux vomica, very helpful, even phosphorus. Another, the people coming and say that they are walking in a pillow-like feeling. When they are pillow-like feeling, that is rubric, like they feel like they are walking on a mud, or they feel like they're not able to balance themselves, or they feel like they're walking on a pillows. It is interpreted as cushion walking. And these are the people who are suffering from diabetic neuropathy or any sensory paralysis or any neurological disorders which are leading to this. Alumina, Cocculus indica also is highly indicated in this kind of cases. Calcarea carp, Carovage, Hypericum, Plumbum, Xanthoxylum. These are the drugs when the patient complains like this. So Zincum Met is another drug everyone knows. Right-sided convergence, brain affinity, spinal cord affinity. It has all actions. But let me tell you, jerking of the extremities. By sleeping, they are jerking like agaricus. There are two drugs, agaricus and Zincum, are highly indicated in these kind of cases. So jerking of the extremities, cold aggravates, and there are a lot of appetite and ailments from suppressed eruption. That is a keynote of Zincum Med, where there is a suppression of suppressed there is a history of suppressed eruption, and after that they are suffering from any disorder, might be anything in the body. Think of Zincum Med. Simple. So it has been also used in subacute sclerosing panencephalitis. Next, if you have lot of irritation in the trachea, in the throat pit, from the cough, you always think of Rumex. Let me tell you another remedy, that is Mentha Piper also. And there are a lot of exertion. After that, there are a lot of swelling in the feet. Rhododendron and ginseng. There are only two drugs. Next, asthmatic heart from fatty generation. So there are a lot of fatty, obese heart. Due to that, they cannot breathe enough. The only remedy, that is arnica. Spotted nails, calcarea carb along with silicia, nitric acid, they are highly indicated in these kind of cases. Last, gingiber. Gingiber has a lot of complaints from eating melons and also drinking impure water. There are a lot of heaviness if they have drink something wrong or something, not good or not pure. And they have complaints, they keep on complaints that I have having diarrhea, having loose motions, I had gone somewhere, I took this and that. You can think of gingiber. It's a wonderful drug. So there are a lot of even diarrhea after melons. These are the single indicated drug only in this condition, that is gingiber. Constipation when enema alone produce a passage. The only remedy which can help, that is hydrostasis. Forget Nux vomica, forget platinum, forget plumbum. The only remedy which can help, that is hydrostasis can. In fractures at the beginning of injury to the soft parts, sprain of elbows, ferrum phos. Licoria so copious that she is compelled to wear a napkin, and the napkin becomes so offensive that it must be taken away and washed at once, as the odor permeates the whole room. Hippocul, not creosote. Creosote generally we see when the patient comes and it smells so bad, so we feel like it feels like creosote-like offensiveness. Better than either arnica or calendula in absorption of intraocular bleeding, that is hemamelis. Another, pain in opposite breast to which the child nurse, borax. Never well since. So never well since, like any childhood disease, sulfur, sorinum. Never well since attack of measles or whooping cough, tuberculinum, carcinosin, and morbillinum. It is missed. Never well since puberty, pulsatilla. Never well since childbirth, miscarriage, abortion, sepia. Menopause, lechesis. A grief or death or beloved, natramure. Or never well since any prolonged mental exertion, silicia and califos. Califos, sleeplessness of the business workers, like a lot of businessmen, they cannot sleep, they're continuously thinking a lot. Influenza, never well since influenza, gelsemium, carovage, sorinum. Never well since pneumonia, sulfur, carovage, phosphorus, tuberculinum, sorinum, another drug, pneumococcinum. If you're struggling with the cases which are not at all improving and had a history of pneumonia, give pneumococcinum and your picture will get clear. Never well since head injury, arnica and natrum sulf. Natrum sulf is one of the only drug which is indicated in the child who is not at all growing well and had a history of difficult birth. Had a history of difficult birth, and these children are not at all gaining appetite or not at all gaining weight, natrum sulf is the only drug for the child born out of difficult birth, have a lot of difficult delivery. Another never well since operation, Staphylococcus aureus and also bismuth. Vaccination, Suja. Chronic Epstein-Barr infection virus, natrum mur sorinum. Another drug I would like to tell in this, that is obviously mononucleosis, sister scan, carcinosin, hepatitis, phosphorus, sorinum. So this is a group which we have created in Telegram group, and I think we are always 900 plus members in this group. You can scan the QR code and join in this group. It's a wonderful group. We share together, we learn together, and we discuss our difficulties in cases and how we can tackle it and how we can help provide the relief to the patient. That is the motto here of creating this group, to serve them with homeopathy and believe them that how homeopathy can work faster and in an effective way. So this is the coming up next session in which I'm going to teach about 42 nosodes in 19th February, starting from 19th February. If you are interested, you can ping me in WhatsApp. The number is given. Thank you so much. Please share your feedbacks on Instagram or messages, whatever you like to share. I would be very happy to know. And I'm very thankful to each and everyone who has attended this session. And hopefully I'll coming up with next with dental Materia Medica of homeopathy from A to Z. That is my next plan. And hopefully by within few days, 10 to 15 days, I'll be ready with that. And I'll just announce it on my Insta channel or in the Telegram group. Your all interested members can join. Thank you so much. Any doubts, please ask.
Thank you, sir. Thank you.
Thank you, sir.
so much, sir.
Thank you, sir.
Thank you so much, sir.
Thank you.
Thank you, sir.
Jitesh, sir, I have one question.
Yes.
Rajgo. Sir, my father is suffering from hypertension. Spontaneously diagnosed. When he go for the follow-up for the skin itching,
Okay.
he take homeopathy medicine for the skin itching, and then
Okay.
diagnosed hypertension, and then homeopaths वो सर थे ना उन्होंने रिफर किया एमडी को वहाँ के, तो वहाँ 210 आया था हाइपरटेंशन, तो सर होम्योपैथी यूज कर सकते हैं?
नहीं, we should have a history of complete case taking लेना होगा, and
Yes.
I should know the cause that why he's suffering. Do you have a history of family of hypertension?
No, sir, no anyone suffering from.
So any ailments or any loss of any complaint, any emotional conflict which led him to hypertension? Do you have any idea about it? Because
Maybe, sir,
as to-
maybe.
yes, we need to find out the cause. Then only we can help in hypertension.
Okay, sir.
Yes, so we need some details. If you can message in the Telegram group, we can help definitely.
Thank you, sir.
Thank you.
I will.
Thank you.
Sir,
Thank-
cough talking aggravates.
Brainia.
Whenever he talks a lot. Sir,
Who? Brainia.
Brainia, sir.
Yes.
And जब भी वो peanuts खाता है, cough start हो जाता है.
That you have to consider cough eating aggravates along with talking
Yeah.
aggravates. I think Brainia would be good choice.
Okay, sir.
Yes.
Thank you. Sir.
Thank you. Thank you so much. Thank you, everyone.
Thank you, sir.
Thank you.
Sir,
Yes.
sir, you told about the fire stigma increasing in myopia. So in which potency we can give it?
30.
Okay, sir. Thank you, sir.
Thank you. Thank you so much. So shall we conclude and call it a day? Thank you so much.